And we are recording. Awesome. Cool. I'd like to introduce myself. I am Master Sergeant Joseph McDowell. I'm in the United States Air Force, currently stationed in Ohio, Wright-Patterson Air Force Base. Right now, I am temporary duty in Hawaii, and the class I'm in is Introduction to Community Health with Eastern Oregon University. Today, I have with me is Miss Camille. Is that right? Camille Edwards.
It's Camille Edwards, yes.
Okay, with Camille Edwards, and she is the health project manager,
The
education
health education
program manager.
program manager, yes.
Okay, and let me see, with the Greene County Public Health uh, company. Would it be a company or just public health?
It's the health department. It's the Greene County Public Health is what we go by, but yeah, it's the health department.
Okay, awesome. Yeah. So Camille Edwards, Health Education Program Manager, Greene County Public Health. All right.
Yes.
And Miss Edwards, so what I'm doing, so this, as I said, my research project or podcast is going to be on cardiovascular disease, and what I've looked at recently is the results from Greene County, I pulled it from the Greene County Public Health Assessment uh, 2023, and it identified cardiovascular disease risk factors. Um, what I'm focusing on, and what I'm focusing on, is obesity, which we for Greene County is at 39%, and a sedentary lifestyle, which is at 19%. And the reason I'm focusing on those two is because I'm tying those heavily into the cardiovascular disease. And with the reviews, the peer reviews that I've looked at, it's for my thesis. But my first question for you is, why do you think um, the percentage rates for obesity and sedentary lifestyle has gone up in comparison to the previous years?
So I really feel like COVID played a big part in that. During that time, everyone was at home, excuse me, not really being out and active. And so I think that played a big role in how we saw that obesity rates go up. One of the things that um, is interesting, though, is that from the 2020 community health assessment to the 2023, we actually see more people reporting exercising at least 5 days a week. It went from 28 in 2020 to 35%. So it really, again, kind of leads you back to that COVID with the change in the new normal.
Hmm.
Um, Pre-COVID, teleworking was not really a thing. You know what I mean? All meetings were really in person. We were out moving around on our day-to-day activities. So the change in those new normals, with work related, even with social life. I mean, now organizations that are working fully remote have socials via Zoom. You know what I mean? Like a lot of things have changed, so people are just at home. So I think COVID played a big role. And then one of the other areas where we see a big increase in this, from 2020 to 2023, is the under 30 population. So it increased from 17% to 40%. So again, I kind of think that generational um, difference of people who kind of were more in the workforce, who were adults pre-COVID, things like that, were used to being out and about, whereas this younger generation has more things at their fingertips, for lack of a better phrase. Groceries can be delivered, medicine delivered. I mean, all kinds of things, telehealth, you know what I mean? All kinds of things. So you also see a generational shift in that as well, which I think a lot of it's just kind of those lingering results of our life when we were in COVID.
Yeah, no, definitely. That actually makes a lot. It makes a lot of sense. I actually did not think about the uh, the COVID era, that new norms, I guess you could say, like, right, because in the beginning, I could think about how I felt personally when COVID hit and we were stuck inside trying to telework. Uh, couldn't go to a gym, had to find other
Mhm.
ways to go out, and for me, it was in Germany, and it was actually they were fining people outside thousands of euros.
Wow.
The cops, if Polizei drove around and saw people outside, and instead of being, inside their house, they were getting
Yeah.
fined thousands of euros. So
Yeah.
that became the norm of staying inside, trying to figure out how to do home exercises for those that always try to be active.
Yeah.
But after so long, I mean, redundancy and being that way becomes, I guess, obnoxiously normal and like comfortable. And it's like, to me, it would be obnoxious to just sit around and be like, or boredom is just, I don't know.
Mhm.
I'm sitting there thinking
Yeah.
about it. Yeah, it makes a lot of sense now, in which for us, a certain generation of like not want to be in, but then the younger generation, it's normal for them.
Mhm.
Fingertip
Exactly.
access for everything. It's easy to order groceries. It's easy to, was it Uber Eats, DoorDash your food, and
Right.
not have to go anywhere. And then um, just watching, sitting down, being a potato, couch potato,
Yeah. Yeah,
watching
and then you
people.
also think, during COVID, you would also see increases in other, things such as, like, alcohol consumption and things like
Mhm,
that. People were at home. So those kinds of all, I think, played into why the obesity rates went up.
mhm,
Like, it was hard to be active and live healthy, but it was so easy to do those unhealthy things or
mhm,
to let those things go, you know?
mhm. Oh yeah, definitely. Um, so with that though, from what you've seen and what you know, would you say that the rise in the cardiovascular disease risk factors are due to obesity and a sedentary lifestyle back in for here at Greene County, or in general?
Yeah, I definitely think that it plays a huge role in it. Because as you see an increase in those areas, you also see a rise in things like high blood pressure, diabetes, which we know are those other risk factors for
Mhm,
cardiovascular disease. So, kind of at the root of it, I do think that focusing on reducing those rates associated with obesity and sedentary lifestyle would lead to improvements in those other risk factors as well.
right. Yeah. No. Definitely. Um, and so with that though, um, according to the community health improvement plan for 23 to 26, 2023 to 2026, which by the way does look solid on what they've identified, especially as the priority identified was adult weight status. If we're up to you, what can we do to help reduce these risk factors for a healthier population, knowing that, hey, what's happened from a lifestyle that's developed as the new norm, from COVID lifestyle and everything going on, how do we how do we make changes? How do we affect these changes? What can we do to
Yeah,
reduce?
yeah, it's definitely not gonna be easy, but we do need to get people out and moving more. So, some of the things that we're doing at Greene County Public Health and with our partnerships here in the county is looking at ways to improve, the, like, healthy eating, active living
Hmm.
programming. So, um, we work on initiatives to get people out, to get people aware of what their public transportation options are, to improve public transportation, to increase access to healthy foods for those that may have transportation barriers, safe routes to schools and food, things like that, so
Hmm.
that we can start making it easier to be active, improving built environment, um, making healthy food more accessible and just make it so that people are able to make that their first choice. But I also think that we have to focus on populations that have historically been underserved, not just within Greene County, but overall. So for the 2023 community health assessment, we oversampled the Black community because we were noticing that our data that we were collecting from the child was not representing the health outcomes we were seeing. So, you see a lot of these health outcomes impact the Black community more. And
Hmm.
so we oversample that population, and now we're able to have efforts focused on accessing the Black community and being able to improve their access and other things that'll help them to have better health outcomes. Because I think you have to look at the populations that are being underserved and really delve into that to improve an overall health outcome. So that's one of the other things that we're really focused on.
That's actually a very good point. When you talk about the community that's in the population that's actually being underserved the most, and that actually leads me into the percentages of our numbers because of the community that is underserved or the population. Um, Knowing that the numbers that was originally polled and how they got the numbers, right? So I'm looking at assessments are polled from those that have reported medical issues or taken a survey. Do you think the numbers could be worse if everyone had the access the access to medical to actually take a survey, or do you think it would be better numbers?
That's a really hard one to answer because it could go either way, you know. When you just think of the nature of a survey, a lot of times people that are doing well don't feel the need to do with the survey. You know, you want to report and share back when you've got something,
Mhm.
for lack of a better phrase, negative to say, you know what I mean? So
Mhm.
it's kind of hard to say if how that would have swayed it. And so we really just try and look at who we're getting responses from, and that's really the best that we can do. So like
Mhm.
I said, that's why we try to focus in and make sure like if there's any gaps, we can target our surveys and push an oversample in an area that we have a gap. Because it is hard to say how that information could be swayed, but
Mhm.
I think that we were able to get a large enough amount of surveys completed to, if nothing else, paint a pretty good picture of what we're looking at for the county.
Right. Yeah, and that's something I was looking at and wondering because, like, throughout this past semester, what we are doing is we go into what we had to do was look at it's called News Today and find articles on a health concern or something that the media tries to identify as a risk or something that they're trying to say. For instance, baby food has too much iron in it and the sample that they have. But what we're looking at is the numbers that they're taking, but which one's actually recording it, which one's saying, and what samples they're taking. And so when I look at the polls and the numbers, it is definitely something that makes me wonder, like if everybody did take the surveys or actually had access to medical and if I went to the emergency whatever if I go because I'm feeling sick for whatever reason that identifies hey it's a cardiovascular an issue
Mhm.
or hey you're obese you're a little overweight this is what's affecting you you can make these changes because not a lot of people have that access to medical or have medical insurance that can take them in there unless it's an emergency in which medical that's the one thing that they can't what I've known as you can't really turn people away for
Right.
when you go into an emergency but to get a scheduled doctor's appointment for being sick and finding out it's because I'm overweight or something like that is it's something a lot of people can't do so you don't get that
Right.
aspect of finding out you don't have everyone wanting to do the surveys so the numbers are we have a picture of people that are willing to take the sur- from that are
Mhm.
willing to take the survey. We know the number population within the county that we have. So and then it's like, okay, how many actually took it in a comparison to the numbers of who we have.
Right.
Still paints a picture, right? And I don't recall the population for Greene County, but with 39% in the obesity rate, and I think we're at 40 for like high blood pressure, 40 something percent. I don't remember 40
It's something in the 40s.
and the 40% for high blood pressure. And I'm looking at that in comparison to just the number of the population size for Greene County. That's really high.
It's very
Uh,
significant, yeah.
and that's and like and that's only taking a percentage of the whatever demographic population that we were able to get. And it does affect a lot, and that's why I'm wondering if it would be worse or be would if it would be better or like in my opinion I personally just seeing these things I personally think it would be worse because I think there's a lot of folks that don't have that access um to actually to go to medical or actually was able to receive the survey and knew there was a survey to take to do
Yeah.
that and that's so that'd be my opinion is it would be worse the numbers would probably be slightly though I think it'd only be like 3-4% higher in comparison to what it is now and I have and that's something I haven't looked at into yet is the demographic breakdown for the county on where we're at, right? For when it comes to Black, Asian, Latino, Hispanic, and white in that comparison to the demographics. So I had not broken that down yet, which I should do. I should do that, and it'd probably help out even more on where we can focus. But yeah, that was man, wow, okay. Um, all right, so pretty much this answers a lot of the stuff I had and the questions I had. Do you have any concerns or questions for me?
I don't really. No,
Okay,
not really.
awesome. All right, I really appreciate your time and helping me out with this to better justify or not justify, but come up with ways and to conclude my podcast I'm going to do, ma'am. And I am.